For more anatomy-related videos, please subscribe to my channel, Learn with Dr. Tanya Hashik.
Hello everyone, in this video we will continue the anatomy of large intestine. In the previous classes, we have already discussed about the first part of large intestine, that is the cecum, and also vermiform appendix. So today we will discuss about the second part of the large intestine, that is the colon. So today's topic of discussion is colon. Colon. So what is colon? Colon is the second part of the large intestine and it is divided into 4 parts. So what all are they? They are the ascending colon, transverse colon, descending colon, and also the sigmoid colon. And it has got 2 flexures, that is the right colic flexure and also the left colic flexure. In this figure, you can see the position of large intestine. So this is how it is placed in a human. So you can also see all the parts of large intestine, that is the ascending colon, the transverse colon, the descending colon, and also the sigmoid colon. So this is the ascending colon. So it extends from the cecum to the inferior surface of the right lobe of the liver. In this figure you cannot see that. I will show another figure which shows the correct position of the ascending colon. So it extends from the cecum to the inferior surface of the right lobe of the liver, and from that it bends to form the right colic flexure. So this is the right colic flexure and it continues with the transverse colon. And this ascending colon, it is about 12.5 centimeter long. So that is about the ascending colon. So now we will discuss the relations of the ascending colon. So anteriorly, it is related to the coils of small intestine, right edge of greater omentum, and also to the anterior abdominal wall. So anteriorly, it is related to coils of small intestine, right edge of greater omentum, and also to the anterior abdominal wall. And posteriorly, it is related to 3 muscles and 3 nerves and also 1 organ. So posteriorly it is related to iliacus, quadratus lumborum, and also transverse abdominis. So these are the 3 muscles. Next is the nerves, that is ilioinguinal nerve and also iliohypogastric nerve. Next is the organ, that is the right kidney. So in this figure you can see the posterior relation of the ascending colon, that is the right kidney. You cannot see the muscles and nerves, that is also related to the ascending colon. So you can see the right kidney in this figure. So that is the posterior relations. So next is the right colic flexure. So it is seen in the junction between the ascending and the transverse colon. So in the junction, the colon, it bends forwards, downwards, and to the left to form the right colic flexure. So this is the right colic flexure. So now we will discuss about the second part of the colon, that is the transverse colon. The transverse colon, it is about 50 centimeter long and it extends from the right colic flexure to the left colic flexure. So transverse colon, it is about 50 centimeter long and it extends from the right colic flexure to the left colic flexure. And as its name, it is not actually transverse, it hangs low like a loop. So it hangs low like a loop and it is suspended, that is it is hanged by means of transverse mesocolon, which is attached to the anterior border of the pancreas. So like its name, it is not actually transverse, it hangs like a loop and it is suspended by means of transverse mesocolon, which is attached to the anterior border of the pancreas. In this figure you can see the transverse mesocolon and you can also see how the transverse colon is suspended by means of the transverse mesocolon. So now we will discuss the relations of the transverse colon. So anteriorly it is related to greater omentum and also anterior abdominal wall. So anterior abdominal wall, it will be a common relation to all the parts of colon. So posteriorly it is related to the second part of duodenum and also head of pancreas, and coils of small intestine. So posteriorly it is related to second part of duodenum, head of pancreas, and also coils of small intestine. In this figure you can see the posterior relations of the transverse colon. So you can see the head of pancreas, the second part of the duodenum, and also the coils of jejunum and ileum. So these are the posterior relations of the transverse colon. So next is the left colic flexure. It lies in the junction between transverse and the descending colon, and here the colon, it bends downwards and backwards, and it lies lower to the left kidney and also the diaphragm, and it is seen behind the stomach and below the anterior end of the spleen. So next is the left colic flexure. It lies in the junction between transverse and the descending colon, and here the colon bends downwards and backwards, and it is seen below to the diaphragm and also the left kidney, and it is seen behind the stomach and below the anterior end of the spleen. In this figure you can see the left colic flexure, and you can also see how the left colic flexure is related to other organs and also structures. So this is the left colic flexure. So next is the descending colon. It extends from the left colic flexure to the sigmoid colon, and it is about 25 centimeter long, and it runs vertically up to iliac crest, and from iliac crest it inclines to medial side, medially on the iliac and the psoas major to reach the pelvic ring. Then it continues with the sigmoid colon. So it extends from the left colic flexure to the sigmoid colon, and it runs vertically up to the iliac crest, and from iliac crest it inclines medially to the iliacus and the psoas major to reach the pelvic ring. Then it continues with the sigmoid colon. So now we will discuss the relations of the descending colon. If you have learned the relations of the ascending colon, it will be easier for you because most of the relations, they are similar. So anteriorly it is related to the coils of intestine and also the anterior abdominal wall, and posteriorly it is related to the muscles, that is the transverse abdominis. We have already discussed about it, quadratus lumborum, iliacus, and also psoas major. And it is related to the nerves, that is the iliohypogastric nerve, ilioinguinal nerve, and also the lateral cutaneous nerve. And it is also related to femoral and also genitofemoral nerve. And the vessels are the gonadal and also the external iliac vessels. So these are the posterior relations. So the muscles, the nerves, and also the vessels. So these are the posterior relations. So now we will discuss the last part of the colon, that is the sigmoid colon. It is about 37.5 centimeter long, and it extends from the pelvic brim to the third part of the sacrum. There it continues as the rectum. So it is about 37.5 centimeter long. It extends from the pelvic brim to the third part of the sacrum, and it is about 37.5 centimeter long. So that is all about the sigmoid colon. This figure you can see the sigmoid colon. So this is the position of the sigmoid colon. So today we discussed the anatomy of the colon. So colon, it has got four parts, that is the ascending colon, the transverse colon, descending colon, and also sigmoid colon. Then we discussed its relations, that is the anterior and also the posterior relations. Then we discussed about the right and the left colic flexure. So this is the end of today's video.
This is the end of today's video. For more videos, please subscribe to my channel and press the bell icon.